Now with a special two-part report about a hospital team helping patients and families confronting death. Here's our reporter, Laura Windsor.
A challenging topic in the medical profession is death. Doctors all over the world try to postpone the inevitable. We spoke with Dr. Michael Ritter and Chaplain Howard Young of Mission Hospital in Mission Viejo, who reflect on those last days and how they assist to give the patient death with dignity.
Our chaplains really play a big role at the hospital here at Mission to help us with those situations where we have an imminent death. For example, somebody that's getting cardiopulmonary resuscitation, CPR, they're not responding to our resuscitation measures. Our chaplains play a big role because that person is deceased, even though we're still doing CPR. But we like to get the family members to see the resuscitation. So one, they can see what's going on. Two, to see that everything was done for their loved one before they died. But most importantly, so that they can say goodbye. And so what we do is our chaplains arrive at all of our code situations in the emergency department, whether it's a trauma, pediatrics, or a medical code. And they work in conjunction with myself to help coordinate bringing the family into the room to watch the resuscitation. We periodically, when we're doing chest compressions, will stop to check the rhythm, and we'll see that flat line, and I'll point out to the family, your father or loved one, whoever it might be, and I'll usually try and use their name if I know it, is not responding to our resuscitation measures. We've got flat line on the monitor. We're only going to go another 5 minutes or so. I want you to say goodbye before we stop. And it seems like a horribly traumatic thing to put them in that kind of a pressure situation. But what our experience has been is it's been better than anything we could have ever imagined, because family members feel like they got to say goodbye to their loved one before they died. In their mind, that person is still alive while we're doing chest compressions, and they can go over and talk to them. We put chairs at the head of the bed and ask them to talk to them. If they want to whisper in their ear, they can, hold their hand. And I'm busy with the code and all the aspects of giving medications and shocking the heart and leading the team. And so I have to depend on our chaplains to help with the family in that interface. And I usually give them clues as to what's going on. And we've done it long enough that it's almost unspoken and know what roles we have to play to make this happen for the family.
My experience as a hospital chaplain is I'm there right when someone dies. So the death is fresh for the family. And what I see is raw, visceral grief. Because what grief is, it's not a disease. It can't be, normal grief isn't medicated or treated. Normal grief is companioned, because grief is the natural response when someone we love dies. What I do is be present for that reaction and response first. And I think by being present, what I do is I validate that what they're doing is okay. Because so much in society, people are trying to contain someone's grief. And by being there and not wanting to fix anything, I'm there saying, by my silence many times, this is what they need to do. Heck, this is what I would do if this were my wife or a loved one in that bed. And the amount you grieve is the amount that you've loved and invested and journeyed with the person who has died. So I'm a companion to the griever.